you have covered so far the inhalation part of this general anesthesia. So today we will cover the second part of the topic, and that is the intravenous anesthetics. Before we start in detail, I would like to share some previous slides of the background. The general anesthetic, you know that they are the drugs that basically used that brings about a reversible loss of all sensation and consciousness. General anesthesia is generally used for the surgical procedure so that the patient would become unaware and unresponsive to the painful stimuli. This is the general concept of the general anesthesia. There are three goals that you have to achieve while you're giving a general anesthesia. There are three targets basically that you need to be achieved. The three targets are unconsciousness, the patient should go unconsciousness, there would be no pain or analgesia, and the third thing is the muscle relaxation. So a good anesthetic is the one which contains all these three properties. Okay, again this is a repetition. This is the main slide, and this is the summary or the classification of anesthetic drugs. So we have divided the general anesthetic drugs into two parts: inhalation anesthetics and the intravenous. So the right one, or the first one, you have covered the inhalation anesthetics. Now we are covering, or we are doing the second part, that is the intravenous anesthetic. Intravenous anesthetic, the different names we have: thiopental, very well known; propofol, ketamine, fentanyl. They are the very commonly used intravenous anesthetics. So we will go in detail of all these intravenous anesthetics. Generally, the mechanism of all these general anesthetic drugs, they basically act on GABA receptor, or specifically GABA A type of receptor, and they actually open the chloride channel, and through this they causes the hyperpolarization, and then it causes all the effects like pain loss, sedation, and loss of consciousness. So the main mechanism of all these general anesthetics is to stimulate the GABA receptor. There are also other mechanisms of general anesthesia. For example, some of the drugs act on glycine receptor. For example, propofol, they act on glycine, which is present in spinal cord and medulla. It's an inhibited neurotransmitter. So some of them act on glycine. Other than GABA, we have glycine. And another one is the NMDA, that is N-methyl-D-aspartate, NMDA. It's a type of glutamate receptor. And the drugs like nitrous oxide and ketamine that we will discuss. Nitrous oxide we have discussed in the inhaled anesthetics. Ketamine we will discuss today. These two drugs act through NMDA receptor, and it causes ketamine causes dissociative anesthesia. So generally, there are four receptors or four neurotransmitters on which this general anesthetics works. Stages of anesthesia you should know, and I thought you have been discussed. There are four stages: stage of analgesia, stage of excitement, surgical anesthesia, and but today's drug, that is basically IV anesthetic, they work on stage 1, stage of analgesia. Also, there are three phases of the anesthesia. We have induction, we have maintenance, and we have the recovery. What is induction? Induction is from the time of administration of anesthesia to the development of surgical anesthesia. This time is known as induction time, and this is usually achieved by the IV anesthetic. So today's drug that we are discussing, they are basically mainly they are the induction agents that causes the induction of the anesthesia. Maintenance is the next phase where you have to prolong this stage, you have to maintain, you have to sustain the stage, and this sustainment of the stage is done with the inhaled anesthetic that we have already covered. Okay, and the final part of the phase of the anesthesia is the recovery. Recovery is just basically the redistribution of the drug from the CNS. So there are three phases. So first phase, induction. We start the anesthesia from the IV drugs, and we achieve the induction. Then we maintain with the inhaled anesthetic. This is also a repetition. I hope this has been covered in the previous lecture. There are also some pre-anesthetic medication that helps in the anesthesia, and we also discuss these drugs. We just discuss the name of the drug. For example, in the pre-anesthetic medication, we have drugs like diazepam, lorazepam. They are the, they are the sedative anxiolytic drugs. Then you have opioids. They are also helpful as a pre-anesthetic medication. Morphine is there. Then we have atropine, this altecolinrolone, the GIT, or wherever you have a secretion in the body, you can stop this secretion before performing the surgery using this anticholinergic. H2 blocker are also decrease the release of acids in the stomach, so they are also, especially in the GIT surgeries. And MSS is also a very important phenomena that happens after surgery, or it can also happen in this surgery. So we give also antiemetic. They are actually used along with this. Okay. Now we come again with the drugs, the different drugs that we use, and in the intravenous drugs we classify these drugs as inducing agents, in which we have thiopental, methylhexitone sodium, propofol, etomidate. Then we have benzodiazepine, that is diazepam, lorazepam, and we have special drug ketamine, which causes the dissociative anesthesia. And then we have the neuroleptic drugs, that is known as fentanyl. Now we discuss in detail all of these. This is again the same slide, having the different names of the intravenous anesthetics. And it is also said that intravenous anesthetics are used for induction purpose. I told you that induction is the first phase of the anesthesia. So these are the drugs used for the induction purpose, and they are not used for the maintenance. And they are generally considered to be not very strong anesthetic drugs. They are considered for the induction process or the initiation process. So they are slightly weaker than the inhaled anesthetics, and this is why they are supplemented with analgesic and muscle relaxant. So we give combination of this intravenous. We start with the intravenous, quick in action, start the induction process, when we add this analgesic muscle relaxant to facilitate the process. So now the drugs one by one. The first one we have from the sedative hypnotic groups, and that is thiopental. Thiopental is a very well known drug. It's a drug used for the early times. Thiopental belongs to basically barbiturates. It's an ultra short acting drug. Quickly, within 15 to 20 seconds, the induction process works. So you start giving the drug to the patient IV, and he start sedating, and quickly it achieves this goal within seconds. So ultra short acting, it has a very rapid induction. The reason why it's very rapidly, because it's very highly lipid soluble. So the brain is a lipid tissue. So the drugs that have a good lipid solubility, they can easily penetrate to the brain, and they can easily quickly cause the induction. They are used alone in short operations. Nowadays, we do not use thiopental as a sole agent, but previously it was used for the short operation. It has a slow metabolism, 15% per hour in liver. Means that the drugs remain in the body. Why we discussed here? Because thiopental, one of the side effects of this thiopental is hangover effects. Okay, you give the drug, but after the patient has come out from the surgery, he is still unconscious. So these hangout effects are very seen in the thiopentol, and this is the reason because this drug is slowly metabolized. So once the drug is slowly metabolized, it will remain in the body for the more time and it will produce its effect. So slow metabolism but quick in action, and it can be done for the short procedures. The other side effects other than the hangover of this barbiturate, this thiopentol, is that it also causes effects on respiratory system. In a high dose, it may cause apnea, which is a loss of the respiration. It causes coughing, chest wall spasm, laryngospasm, bronchospasm. So the drug needs to be given with a careful because it has a low therapeutic index. So the side effect would be it causes the respiratory depression. Also, it on CBS, it also causes the hypotension and hypovolemic shock. So the patient who have a history of hypotension or blood loss history or hypovolemic shock, thiopentol is not a good choice to given in this patient because it further decrease the blood pressure and the it can precipitate this hypovolemic shock condition. The first drug we have the thiopentol that belongs to the barbiturates. Quicker in action, slow in metabolism, so more remain in the body. It has a side effects on the respiratory system and cardiovascular system. Another drug belong to the same group with the barbiturate is the methotrexate. Methotrexate is also basically it's a methyl derivative of the thiopentol. It's known as methotrexate, and this drug is also a modified form of thiopentol, and it has the same properties than the thiopentol but has less side effects. So nowadays we also use this methotrexate as compared other than this thiopentol. The third drug is Etomidate. Etomidate is also belong to this category, and it's a hypnotic agent, causes sleep induction. Chemically, it's an imidazole derivative. It's chemically, you would have come across imidazole is a compound like research structure, like you would have discussed in different. When you talk about the chemistry of the drug, this imidazole chemically derivative. It has a low analgesic activity or almost least analgesic activity. It's a poor water soluble. But the good thing about the Etomidate that it has little or no effect on heart and circulation. So this become a good choice to give in the patient of coronary artery disease problem or cardiovascular dysfunction. So when you are operating a patient who have the cardiac symptoms or the compromised cardiac system, so this is a good choice to give. So this Etomidate can preferably use in the cases of the cardiovascular patients who has this coronary artery disease problem. So this is a speciality that it can be used in this type of patient. Okay. So first drug we discuss is the barbiturates. In the barbiturates we discuss the thiopentol, the ultra-short acting. Then we say that methotrexate is also the same or a derivative like of this compound thiopentol. And the Etomidate, we said that this is also a compound drug which has the same property, but it has a low or little or no effects on heart, so this can be a good choice for the coronary artery disease. Propofol, nowadays this drug is very commonly used and it's very successful. Propofol is basically an alcohol, and more precisely we can say it's diisopropyl phenol. Chemically this is its name, and this drug is nowadays replacing the thiopentol nowadays. Thiopentol, which is an ultra short acting drug and quickly achieving for the intravenous anesthetic. Nowadays we have this drug which is basically replacing the thiopentol. So obviously it has a rapid induction within 30 to 40 seconds and good distribution. The half-life is very short, 2 to 4 minutes, means it is rapidly metabolized into the body and quickly eliminate. So this stays less into the body. poor solubility in water, which is we already discussed. So good induction, short half-life, and this is used diabetic as a drug, and it has a less hangover effect. Okay, so awakening within 8 to 10 minutes. This is its property. But we discussed with the thiopental that thiopental has a long hangover effect because it is slowly metabolized, it remains into the body. This drug is achieving the same target within seconds, but the half-life is slow, rapid, means it remains less into the body for the less time, and it quickly eliminates from the body. This is why it has a less hangover effect. So within 8 to 10 minutes, is a very good recovery time, or the patient becomes conscious after the surgery, and it has a less hangover effect. So this propofol nowadays preferably used in the cases of surgeries like resection of spinal tumors. It can so short procedures for spinal tumors or condition, you can use this propofol, and it also causes the hypotension. So again, propofol is not a good choice with the patient having the cardiovascular problems, or they have low blood pressure or hypovolemic shock. So again, this is not also. Remember, when you have a hypovolemic problem, cardiovascular, Etomidate is a good choice. So this could become your question in exam, which is the best drug to use with the coronary artery problems. Nowadays, a new form of propofol is there, that is phosphopropofol. It's a phosphate form of the propofol, and this is water soluble. So this drug is nowadays used because sometimes this why we have make a change and why we covered a new drug, because although it's a good lipid soluble drug, but sometimes it causes the pain at the injection site. So this is one of the aspects that this drug is basically causing the pain. So we have produced the new water soluble form of this propofol. Then we have the third drugs, so barbiturates. We have in the barbiturates we discussed thiopental, methoxytal, etomidate. Then we discussed the propofol. The third part is the benzodiazepines. Benzodiazepines are not the main inducing agents, or they are not the main IV anesthetic. They could be considered as pre-anesthetic, but the commonly type of benzodiazepine that we use is midazolam, diazepam, and lorazepam. It's there's a long list of the benzodiazepines. So all the benzodiazepines are not used. We preferably use among the benzodiazepines the midazolam, diazepam, and lorazepam. And what is the alarming action of these drugs, that they may cause respiratory depression. So again, whenever you are using the benzodiazepine, you should consider this effect that it may cause the respiratory depression. If you give an overdose form, it may cause this respiratory depression. Then we have a fourth drug, that is ketamine. Ketamine is a very different drug in the IV anesthetic, and it is a drug chemically known as phencyclidine derivative. So this drug is more, if you can go the details of the drug, this is more related with this, the drug which causes the changes the behavior pattern of the patient. So phencyclidine, this sort of compound, are also used in the behavioral problems of the patient. It's a phencyclidine derivative, and it works on a different receptor that is known as NMDA receptor. So ketamine act on NMDA receptor. Most of the time we discuss that the anesthetic drugs act on GABA receptor, and they cause the activation of the chloride channel. This is the general mechanism, but ketamine has a different mechanism of action, and it works on an NMDA receptor. The ketamine produces a special effect which is known as dissociative anesthesia. What is dissociative anesthesia? It's a type of anesthesia which is characterized by the immobility, amnesia. This is the main feature, the loss of memory for the short period of time, analgesia, and light sleep. Actually, the patient feels the dissociation from one's own body and mind and the surrounding. What he feels that he is conscious. In the dissociative anesthesia, if you would have an experience, if you will have experience in your future of the surgery, which are conducted while using ketamine, you would see that the patient would be conscious. He would be conscious and he sees what is happening, although he is pain-free, but he knows that I am in an operating procedure. So sometimes he's also saying some foolish words to the surgeon as well. What are you doing with me and other things? And he start quarreling or trying to fight. But once the operation is done and you ask something to him, what happened to you? He forgot everything. So dissociative anesthesia is a condition in which the patient was conscious. He sees everything, but he lost his memory and a short loss of memory. So he doesn't remember anything what happened to him. This is a sort of condition known as dissociative anesthesia, and this is mediated by the NMDA receptor. This sort of surgeries are done mainly in the children and in the elderly adults for short procedure. So it has a different mechanism. Ketamine also causes or it also increases the central sympathetic outflow. So again, it is a good drug to use in a condition like hypovolemic shock or cardiogenic shock, because it increases the sympathetic outflow. So once the sympathetic outflow increases, means there is increase in the cardiac activity. So again, the patient, like we discussed, that Etomidate can be used in the hypovolemic shock. Etomidate belongs to the Barbiturates. So if you want to, if you see that the patient having a hypovolemic shock or a low blood pressure, is going in hypotension, so you can use this Etomidate, or you can use also the ketamine, because ketamine increases the central sympathetic outflow. And also another good thing is that it's a potent bronchodilator. So another advantage that it also causes the bronchodilation. So this can be safely used in the asthmatic patient, or it can facilitate in the patient of this. So asthmatic patient having low blood pressure, so the ketamine is a good choice, and it is usually done in the children and the elderly patient. What is the side effect? Every drug has a side effect. What is the side effect? It causes the hallucination. I told you that ketamine is a more drug which basically it alters the behavior of the patient. So sometimes the patient who have taken this ketamine, they complain of nightmares or the hallucinations to them. Also, it's a cardiovascular stimulant, so it should not be given in the hypertensive patient or stroke patient, because they both can increase the blood pressure. Condition can worse, like stroke or cardio. So you have to see the patient if having history of this high blood pressure or having previous complaint of the stroke, so you better to avoid. Otherwise, it's a good drug to use for the short procedure, and you don't have to actually sedate the patient, or you have to make him unconscious. So quick recovery from this drug. Fentanyl is the fifth drug that we discuss, and it's an opioid. So what is the property of the opioid? It's a strong analgesic. Okay, so fentanyl is nowadays used. It's a very strong analgesic. It's not very good analgesic means, but this is mainly used as a good analgesic agent. The analgesia is main requirement of the surgery. All you have to do is to get free the patient from the pain. Duration of action is short, within 30 to 15 minutes. So this drug is basically used for the short procedures. Okay, you don't have to make the patient unconscious. You have to do a short procedure like dental procedures and endoscopic procedure. This is a good choice. Nowadays, fentanyl is solely used for short procedure like dental endoscopy, where you don't to unconscious the patient. Drug can be given IVs. Obviously, this is a drug we are discussing on the IV anesthetic, but it can be given as epidurally or intrathecally. So it can be given as a CSF as well. Then the new form of the fentanyl is also there. They have the new drug coming, or the derivative of this drug, having few side effects and good recovery. And the drug like alfentanil, sufentanil, remifentanil. So this is the different sister drugs of the fentanyl, and they vary from their minimal side effects, solubility, and all these factors are involved. So again, I told you that the clinical use of the fentanyl is that with the diazepam or other drug, it is used for the diagnostic, endoscopic, and angiographic procedures. So short procedure like endoscopy, or you have an angiography where you don't have to unconscious the patient. You give this drug fentanyl. It's a good choice. Also adjunct to spinal and nerve block anesthesia. This is also given in this nerve block or other procedures. Dexmedetomidine. This is another drug, and this drug is a alpha-2 agonist. It's a centrally acting alpha-2 agonist. And you know when alpha-2 agonists work, it's an analgesic and hypnotic. It has an analgesic and hypnotic action, and this drug has a rapid clearance and short elimination half-life. And this dexmedetomidine is used for short sedation in an ICU setting. So short procedure where it is used like in ICU, and it provides sedation without respiratory depression and blunts the undesirable cardiovascular. Not very commonly used this drug. This can be used in the short procedure like in ICU setting. Probably this is the last slide. So far we have discussed. Yes, this is that. I just repeat for a time so that you can recall the drugs. This is a slide showing all of these intravenous anesthetic. The thiopental we discussed. The thiopental or thiopental both are same. Methotrexate and methotrexate, sodium is same. Propofol is there. Etomidate is there. Okay. Then we have the diazepam group, benzodiazepine group, lorazepam, midazolam. Ketamine we categorize in a different way and causes a dissociative anesthesia is ketamine, and fentanyl is basically a drug which is known as neurolep. Neurolep is something which affects on the psychology or the neuroleptic drugs are generally classified as antipsychotic drugs. So it has some relation with this psychosis, so this is also known as neuroleptic analgesia. And then we usually discuss the thiopental, which belongs to benzodiazepine group, its action. Then we discuss methotrexate, which is having the same action. Etomidate. Etomidate is a good choice for coronary artery disease. And propofol is nowadays a drug used. It has a less hangover effect and good recovery, rapid induction. Another new form of this drug is phosphopropofol, which is a water-soluble form. So the side effect that it causes, the pain at the injectable side is reduced. Diazepine we did not discuss in detail, but these are the three main diazepine that we use in the anesthesia. Not all benzodiazepines are used. Ketamine we use as it causes dissociative anesthesia, and it works on an NMDA receptor. And the property of ketamine is that it increases sympathetic outflow, so it can be used to the patient with the hypovolemic cardiogenic shock. Also, it's a good drug to use in the asthmatic patient because it's a good bronchodilator. The side effect of this drug that it works on behavior pattern, so it causes sometimes hallucination. Okay. Then we discuss the fentanyl, which is an opioid, and this is a good drug to use for the short procedure and like endoscopy, dental procedures. So it's a good drug having a good analgesic activity, and it is used for the short procedure. And finally, we discuss the dexmedetomidine, and it's not very commonly used, but it is used for the short procedure and a procedure like in the ICU setting. So topic was not so prolonged as like inhaled anesthetic, which we discussed commonly in more detail. So these two lecture makes the complete of your general anesthesia. Now the session is open for any questions if you have. Okay, going to the chat and discussing. Okay, this is one of the question is, can you repeat dissociative anesthesia? Dissociative anesthesia is a type of anesthesia in which the patient is conscious, but he has a short loss of memory. This side of the patient is actually he's outside from the surrounding. So usually he is conscious, but he lost the memory after what has happened. So this sort of anesthesia condition is dissociative anesthesia. Okay. Actually, the last class was taken by Dr. Imran. I am taking his second lecture because he's not feeling well today. So I have to take. I don't know whether he asked. Okay. Why hallucination occur in ketamine? Hallucination is a side effect of a ketamine. I told you that you see the effects of drugs, or all the drugs are not very much targeted. You always have a side effect. So this drug belongs to a chemical class which basically causes this sort of hallucination. Phencyclidine, I told you. So this stuff, the other type of the drug, they also causes the hallucination. So this is one of its effects. So we control this type of thing with controlling the dose of the patient. Because nitric oxide diffuse rapidly from alveoli, so it causes accumulation of other. So this is what Horner is giving answer. But sir asks, dexmedetomidine is still used in ICU. Yes, this is a drug, but not very commonly used. There's a difference between stages and phases of anesthesia. Okay. You can differentiate. The things are more simultaneously are used, but this is we describe because you can understand so which type of drug is acting on which phase of the anesthesia, phase of the stage. So they could mix together, but the reason why we are discussing here is a part of physiology, but we are discussing because we want to emphasize on that some of the drug they act on induction phase, some of the drug act on maintenance phase. This is why we discuss these phases and these stages. Okay, I don't see any more questions, so I'm here for the 2 or 3 minutes. If anything you want to ask, you may chat. Otherwise, the things are clear. It's good enough. Just complete your topic of general anesthesia. Probably the next lecture we are going to start with the local anesthetic.